Calcium channel blockers are the next category of drugs that are used for treatment of hypertension. So we will study the basic mechanism associated with the calcium channel blockers. So this is the cell membrane on which these calcium channels are located. So whenever there is activation of calcium channel, there will be opening of this calcium channel, which can lead to cause influx of calcium, and the entered calcium will bind to these colmodulin molecules, which is resulting in means formation of complex, which can result in activation of this MLCK fragment. So phosphorylation of the MLCK fragment will result in actin myosin complex generation, which can cause the contraction mechanism. So when excessive calcium is there, and due to that there will be an excessive activation of this pathway, and it can result to cause the rise in contraction. So this can lead to cause rise in contractility, which can increase blood pressure and can cause hypertensive state. So if we want to minimize the hypertensive state, then we have to minimize this contraction by reducing the influx of calcium. So calcium channel blockers are the drugs those are directly blocking the activation of calcium channel. So influx of calcium gets minimized, and due to that there will be relaxation. So we'll discuss about some points which are coming under the category of calcium channel blockers. So calcium channel blockers drugs are of three kinds. That means the dihydropyridines, then phenylalkylamines, and benzodiazepines. So this verapamil is coming under the category of drug that is phenylalkylamines, and diltiazem is coming under the category that is benzodiazepines, and the nifedipine or all dipines are coming under the category that is dihydropyridines. So all these agents are showing their effect by means reducing the calcium channel, and due to that there will be negative inotropic effect and reduction in the contraction mechanism. So verapamil is showing its effect that is oriented towards negative inotropic effect and can cause reduction in the blood pressure, but again it is having some toxic effects also, like it can precipitate heart failure or some borderline cardiac conditions also. Then next, diltiazem. So as compared to verapamil, it is a less active drug, and it can show its mechanism that is to lesser extent. Then the adverse effect associated with diltiazem and verapamil are bradycardia, AV block, heart failure, anorexia, nausea, peripheral edema, hypotension, and constipation. Then some points associated with the dihydropyridines. So dihydropyridine are causing means they are having peripheral vasodilatory effect, which is means much more, and due to that it can produce baroreceptor mediated reflex mechanism. So it can again produce the totally opposite effect, and it can again neutralize the effect also. Again, these category of drugs, they are not having properties for means reducing the AV node conduction, and due to that they are means we can't use those drugs for treatment of supraventricular tachyarrhythmia. So that is the kind of arrhythmia, and means we have to discuss this later on. But these category of drugs, they are not showing any beneficiary outcomes in case of this kind of management. Then adverse effect associated with the dihydropyridines. So they are acute hypotension, dizziness, flushing, headache, gingival hyperplasia, and next is peripheral edema. Now next class is that is centrally acting alpha 2 agonist. So these alpha 2 receptors are located on the preganglionic nerve fiber. So whenever there is release of catecholamine, so these agents are inhibiting the release of catecholamines, means they are producing some opposite mechanism. So when sympathetic catecholamine is being released, they will inhibit the release of this sympathetic catecholamine release, and due to that the sympathetic tone, or the effect can get minimized. Means these are the balancing mechanism associated with the alpha 2 agonist. So whenever there is excessive activation of sympathetic tone or excessive activation of release of sympathetic catecholamine, so these agents are helping us to neutralize the effect, and that's why we are utilizing the drugs which are showing agonistic effect associated with alpha 2 mediator response. So example of drugs that are coming under the category are clonidine, then guanabans, then guanfacine, and methyl dopa. So they are stimulating the alpha adrenergic receptors in the brain, and due to that there will be reduction in the heart rate, reduction in cardiac output, reduction in peripheral resistance, reduction of renin activity, and baroreceptor reflux, which can be utilized for minimizing the complications associated with the hypertension. Since release of catecholamine is inhibited, its response will also get inhibited. So here is its depiction. So they are rising the vagal tone, vagal activity, and due to that there will be means reduction in the activity of the heart. Again, they are minimizing the sympathetic tone associated with the means release of neurotransmitter. Again, due to that there will be reduction in heart rate, reduction in total peripheral resistance, and there will be reduction in the venous return also, and it can lead to cause reduction in the blood pressure, and that will be helpful in case of hypertensive state. So here are some adverse effects associated with the centrally acting alpha 2 agonist, that is depression, hypertension, dizziness, anticholinergic effect, and after administration of for chronic period of time they can cause sodium fluid retention. So we have to check continuously the sodium water levels also, or we have to monitor that condition also. Then the abrupt cessation means the sudden stoppage can lead to cause rebound hypertension. So we can't stop those drugs suddenly. And methyl dopa, so it can produce some rare events like hepatitis and hemolytic anemia in some cases. Okay, and methyl dopa, it is the safest drug that can be utilized in case of pregnant women also. Now next class is there, that is postganglionic sympathetic inhibitors. So they are directly inhibiting the release of these catecholamines, and they are reducing the responses of sympathetic tones mediated by those category of drugs. So examples are guanethidine and guanadril. So the the mechanism of this kind of drug is resulting in reduction of cardiac output as well as peripheral vascular resistance, which can be beneficial for hypertensive patient. So we can also use these category of drugs for management of hypertensive state.